Measures to curb drug resistance. For clinical efficacy of an antibacterial, it is essential to prevent drug resistance. Following measures can be taken to curb the problem of resistance. AMA, or antimicrobial agents. AMA is an agent that kills microorganisms or stops their growth. Antimicrobial medicines can be grouped according to the microorganisms that act primarily against. So these are the combinations of AMA. First is to achieve additive or synergistic effects, to broaden the spectrum of antimicrobial activity, to curb the development of resistance, to decrease the intensity of toxic effects. Chemoprophylaxis. So what is chemoprophylaxis? Chemoprophylaxis is the use of an AMA to prevent the setting of an infection in the body to combat a contacted infection before its final clinical manifestation. Second is it reduces the number of the viable microbe below the critical level, thus preventing infection. And lastly, it is highly unsatisfactory and condemnable, even hazardous if it is done for prevention of infection in general. So what are the misuses of AMAs? So these are the misuses of AMAs. First is treatment of untreatable diseases. Example of these are the use of antibiotics in viral diseases. Second is improper dosage. Antibiotics should be administered in proper therapeutic dose. Third is superinfections, inhibition of starter in bacteria. Next is the antibiotics as growth promoters. Then, application of antibiotics in surgical wounds without proper drainage. And lastly, improper dosage. So, probiotics. What is probiotics? Probiotics are products containing viable, non-pathogenic microorganisms administered orally to alter the intestinal microflora. Example of these are Lactobacillus, Bifidobacterium, Streptococcus salivarius, some Enterococci, and Saccharomyces boulardii are some of the presently tried prebiotics. Studies have shown them to be useful in acute infectious diarrhea following antibiotic administration. Probiotics are live microorganisms that are intended to have health benefits when consumed or applied to the body. Prebiotics. So, what are prebiotics? Prebiotics are non-digestible substances which stimulates the growth of intestinal flora and thereby prevent the colonization by pathogenic bacteria. Example are lactulose and inulin. So, prebiotics are a form of dietary fiber that feed the friendly bacteria in your gut. This allows your gut bacteria to produce nutrients for your colon cells, which leads to a healthier digestive system. And last but not the least is antibiotics in pregnancy. So, as far as possible, antibiotics are to be avoided in pregnancy, which are very few of them have been known to be safe in pregnancy, like penicillins and some cephalosporins. Many of them, including tetracyclines, chloramphenicol, sulfonamides, and aminoglycosides, should be avoided in pregnancy.